The broadcast is now starting. All attendees are in listen-only mode.
For those of you on the call, this is Gillian Middlestead. I'm just going to let you know we're going to get started in a minute or two. And I just heard music. I don't know about you all out there, but there was a music playing. So I'm going to go ahead and mute myself. We're going to get started probably 1 to 2 minutes after the hour because we do have a full webinar today. Thanks. All right. Good morning or afternoon, everybody. Mansell Nelson's going to go ahead and get us started with some housekeeping before we go into our expert panel. So thank you for joining us. And Mansell, if you want to start us, I can't see the controls for some reason when I'm doing the slides. So I'm going to go ahead and move the slides forward. But Mansell, why don't you get us started and get us going here? And Mansell, if you are speaking, I can't hear you yet.
Thank you, Gillian. This is Mansell Nelson with the Institute for Tribal.
And Mansell, your audio just cut out.
This is Mansell. Can you hear me, Gillian?
I can, yep. Actually, let me just, yep. I could hear you, but you were cutting in and out. All right, so for the
Okay,
audio.
well, let's try this again.
Still nothing.
So this is Mansell Nelson with the Institute for Tribal Environmental Professionals. Welcome to our professionals. Welcome to.
All right, Mansell, I'm going to go ahead and try to take the
There seems
controls.
to be a delay in the.
All right. If anyone can type it, and everybody, just so you know, there's about 2.3 million people around the U.S. on webinars
Yeah, go ahead.
right now, and this is going to be an issue that comes up today. So please bear with us. We're going to do the best we can, but there might need to be a little bit of patience here. Yep. And as you can see, we had 2,300 organizations register, only space for 1,000. So for anybody on the call right now, I want to emphasize that the entire live webinar will be recorded. All the slides will be available to you and they'll be sent out on a link. And then we've created a resource kit. So everything you see today, in addition to 10 or 15 other resources, will be available on our through a link that you will all be sent. And our goal is for you to utilize this in your organizations and then to turn and disseminate it to the people that you work with in your communities. Very quickly, I'm going to go through, and I realize we're not seeing a traditional screen, having a few issues with that, but I think most of you can see my screen right now where you see today's webinar slide. So for those of you who haven't used GoToWebinar, you're all muted, but you can type in questions. If you're having any audio issues, this orange tab on the right will allow you to access the audio in the questions box. Our Q&A session at the end will just be typed in, so please make a note, and that's on our next slide here. That again, if you haven't used GoToWebinar before, on the far right side of your screen, you'll see there's a box that says questions here, and it looks blank, but below that, where it says type question here, that's where you're going to want to put in your questions for us. And again, all questions are going to be held until the end of the Q&A session. And as I already just mentioned, as you can see on the slide, A, we're recording, B, everything you hear today will be sent out to you. Very quickly, I'm not going to read this slide. This is the order, though, of the presentations today. I can see there's a lag here. On the left, I just want to call your attention to, we have a 45-minute expert panel going through the the practices and the science of safe cleaning and disinfecting, followed by key federal agencies who were able to join us today to talk about what their agency's guidance is with respect to cleaning and disinfecting. And then we're going to close because we have tribal and general audiences today, but the indoor air resources, so we're going to go expand beyond COVID and talk about what else about the indoor environment we can provide to you and all the partners on this call. So speaking of, and you'll hear from many of them today, I'm not going to read this next slide, but these are some of the panelists. The Partnership for Air Matters hosted this today in conjunction with tribal, local, state agencies, and federal agencies. So thank you all who are participating. And on that note, before we get started, a couple of things I want to mention. Tribal Healthy Homes Network, we connect tribes, tribal consortium government to promote just, healthy, and safe living environments for tribal communities. So that's one of the organizations here today. I want to call out the Tulalip Tribes of Washington. They are longtime supporters of the Tribal Healthy Homes Network. They're our host organization. They provide leadership. And Dean Henry within the tribes is a real Healthy Homes champion. So thank you. And EPA for investing in tribal capacity through us. Partnership for Air Matters organized this today. We're a collaborative that focuses on knowledge and tools to inform, engage, and empower families. And then our co-host today is the Institute for Tribal Environmental Professionals. Mansell was the person who you might have heard earlier, but that did not work. All right. I'm just going to do an audio check. Mansell, can you confirm? I'm going to unmute you. Can you confirm that you hear my audio? Mansell, you are muted, self-muted. Can you unmute to confirm that you can hear me? Or Nancy?
Yes, Gillian, I can.
Beautiful, thank you.
I can hear you.
Okay, I just had someone text me that they couldn't hear me.
I can hear you.
All right, we're good. Okay, only 8 glitches so far, everybody. Let's keep going. All right, so before Nancy Bernard, our first speaker, starts, I have a couple points I want to make. And as you can see here, I think the slide that, well, at least is about to show up, is that the indoor environment always matters. And so, yes, today we have 2 aims for the webinar. One is we really want to separate fact from fiction because there's a lot of information circulating. It's inaccurate at best sometimes, and at worst, it's actually dangerous. There's been a spike in calls to Poison Control Center. children and adults alike have been poisoned or exposed. And what's not reported is we know that it's likely an increase in asthma episodes and exposure to cancer-causing chemicals. So today, yes, we're here to focus on removing COVID safely and effectively, but we're also here to talk about the other harms in the indoor environment. Our second aim for this webinar today is to connect you with those agencies, particularly specific people whose job it is to know the best available science and to make recommendations based on that science. I realize trusting government isn't always in everyone's wheelhouse or comfort zone, depending on where you are, but it is a good time right now to look at those people who are here today, whose full-time job it is to reduce harm of exposure to airborne contaminants. And finally, to close here, I want to point out that thinking about the indoor environment is not critical just during a pandemic. We do live our lives, we love the outdoors, but not only do we spend 90% of our time, but due to climate-related episodes, we spend even more time indoors. And inside those structures, we breathe. By the time this call's over, you'll have had 1,470 breaths. By the end of today, you'll have taken 20,000 breaths. And every time you breathe, you introduce oxygen into your lungs. But you're also potentially introducing invisible substances that go through your lungs, your bloodstream, into your organs, your brain, and your immune system. Some of those substances are harmless, but many are not. We have over 45 different chemicals that are routinely found in house dust, let alone what's outside: diesel, air toxics, wildfire, wood smoke, pesticides, and radon that also infiltrate our homes. So today, as we wrap, I want to emphasize, as I wrap up, I want to emphasize that we hope that we're on your radar now, and that our programs and our resources are now available to you to help complement your work, whether you're in housing, healthcare, education, emergency services, social services, or you're here because you're caring for an elder or raising your family. We want you to know about the other harms in the indoor environment so that we can be a catalyst to helping you protect you and your family. And we also understand some of you may not have control over the construction, the ventilation, or the filtration in your home, or you may have damage in your home that your property manager hasn't fixed. We understand you can't control those dimensions, but we do know that you can control what you bring in your home, what you use, and how you use it. So with that, I'm going to go ahead and kick off with Nancy, our first expert panelist. Nancy, I'm going to change the presenter controls to you, and please go ahead and get started.
Can you all see my screen? Hello?
Yes, go ahead.
Yes.
Can you hear me?
Yes.
Okay, that was awkward. You can see my screen and you can hear me. All right. I'm Nancy Bernard. I am with the Washington State Department of Health. My primary work is with K-12 schools, but I am also the state indoor air quality specialist. With the schools, I do a lot on cleaning and disinfecting for health. And I answer a lot of questions from the general public around indoor air quality. One of the things I talk about is spreading germs. So if we're going to clean and disinfect for health, we need to understand the germs and where they're transmitted and what we can do about them. So these are your primary means of transmission of any types of germs or microorganisms that can cause disease. Foodborne, waterborne, those two are a primary programs in public health. So at the national, state, and local level, we have strong programs to try and prevent foodborne disease and waterborne disease, and we do a really good job at that. Person-to-person transmission of disease is where we, in particular right now, are focused because of the COVID-19. COVID-19 is a respiratory virus. It is a novel virus, which means it's a new virus that only started to infect human beings probably in December. There will be much more research to come out, much more tracing of the transmission, but it's important to think about it. This virus came out into the humans and circulated around the world in less than 3 months. That's how much we talk, breathe, and travel. So with a person-to-person transmission, we're trying to control what's coming out of our mouths when it's an airborne or droplet transmission respiratory virus. And also with a lot of our viruses and bacteria that cause disease, they're enterics. They are oral fecal. That tends to gross people out, but a lot of us environmental health specialists are good at that. We want to stop transmission of organisms both ways, the oral fecal and the respiratory viruses. You may be following the news and seeing a lot of discussion about COVID-19. Is it truly airborne? Is it mostly droplet transmission? Right now, they're pretty much thinking it's mostly droplet transmission, but there's not a fine line between these two things. It really has to do with how quickly the viruses dry out and are able to float in the air. There could be both going on with this virus, but primarily it's considered droplet. The droplets come out of your mouth. They come out when you talk, but they really get broadcast when you sneeze or cough. And most people get sick by inhaling those respiratory droplets, but they can pick them up on surfaces, which is why we have the big social distancing and no hand washing, because if you have covered your nose or your mouth when you coughed or spoke with your hand and not a Kleenex like this little boy or a handkerchief, and it's on your hand, and then you shake hands with somebody, they can pick them up off their hands. The emphasis on disinfection is around contaminated surfaces, and that's because we know that when the viruses come out, whether with this gentleman or with your hands, they can get on surfaces, people can pick them up and deliver them to their eyes, nose, or mouth and get sick. So prevention is everyone's job, and I can tell you I have been using this slide in my teaching for a very long time. This has not changed because of COVID-19. This is basic for everybody, for everything. Wash your hands with plain soap and water and wash them often. That is not new. Our grandmothers and our great-grandmothers were saying that. Cover your cough or sneeze, preferably with a handkerchief, but if you don't have one, do it into your elbow. That way you're not getting as much on your hands. Then don't touch your eyes, nose, and mouth. I tell people all the time, this is how we inoculate ourselves if we pick up organisms off of surfaces or other people's hands. We deliver them to ourselves through our eyes, nose, or mouth. So it's really a very simple message. Do not assume any surface you touch is sterile, because they're not going to be unless hopefully it's a hospital surgical room. We would like those to be sterile. And so just assume you're picking up viruses and bacteria and other organisms. Don't touch your face unless you've just thoroughly washed your hands. Stay out of spit zones. Okay, that's my term. I've been told. I'm sure I heard it from somebody, but I've been using it a long time. This is the hardest piece of controlling respiratory viruses, whether it's influenza, colds, or the novel coronavirus, the COVID that causes COVID-19. This is the hardest thing to do under normal circumstances. With all the social distancing that we are now asking everyone to do, the staying at home, the staying 6 feet away from everyone that you possibly can, we are doing a much better job of staying out of those spit zones. But think about it, you are being asked to keep a 6-foot bubble around you, and everybody else is being asked to keep a 6-foot bubble. So when you're at home, think about how your 6-foot bubbles intersect. And remember that that's only a piece of the control for this virus. But in general, it does a very good job. Get vaccinations. That's key to public health. There isn't one for COVID-19, but if all goes right, there will be. Good ventilation. The more outside air you can bring into your home, your office, or your business, the more dilution you have of all the chemicals that are in the air and the viruses that come out of our mouths. So the more ventilation, the better. Sleep with your windows open if you can. Hopefully you have good air quality. Bring in the outside air. Stay home when you're ill. Everybody's paying attention to that one right now. This has been a huge problem, though, in the past. There are many people who don't have good sick leave, who do go to work ill, or children who show up at school ill because there's no place else for them to go. That is how we keep transmitting viruses around. Right now, with the stay-at-home orders, we're working really hard on keeping people home when ill and the social distancing. And as always, support public health. One of the things I do in schools is to try and get more sinks, more sinks, so people could hand wash. So soaps need, fragrances are one of the biggest complaints I get from the general public and from schools. There are so many fragrance products out there now. People become very sensitized to them. There's thousands of different chemicals under that term fragrance. And many of them are highly sensitizing. Some of them are not good for your health. So if you've noticed, some of your schools and businesses are going to fragrance-free soaps. The University of Washington did this, Department of Health, I noticed it, Century Fields. It is better for human health. Fragrances trigger asthma, headaches, and skin reactions. So they're not necessary. And so dye is not necessary. That's for the environment, because remember, everything goes down the drain and that's going to end up in our water systems. So better for human health and for the environment to have fragrance and dye-free. Scrub for 20 seconds. People have been talking a lot about that now, because we know that you need to scrub stuff off your hands. You do not need antibacterial soaps. In fact, they are not good for human health. They are not good for the environment, and they will do nothing for COVID-19 or any other virus, and they actually don't kill most bacteria. So they're completely unnecessary. It's just marketing. This is a diagram that won't be on the PDF that you're sent because I didn't have time to ask the New York Times for permission to use it, but I will include the link. It's a really good article on how soap breaks apart lipid enveloped viruses, which is what COVID-19 is. It has this yellow here is a fatty layer. These are those protein spikes that everyone keeps seeing. Those are what attach to the cells in your respiratory tract that are causing, allowing the virus to enter your cells and replicate. The soap has a head that bonds with water and a tail that avoids water and bonds with oil and fat. This is why soaps are so important for washing. They help you remove soaps and fats from your hands, from your dishes, from your clothes, and with that removal go the microorganisms down the sink. We really don't care if things are alive or dead when they go down the sink. We just want to wash everything off. This is showing how the soap will actually break apart the virus. So when you're thinking about wanting to kill this virus, think in terms of soap. So wash thoroughly, wash everything down the drain. Hand sanitizers are really popular again. If you want to use them, obviously you can. They should be at least 60% alcohol. They are flammable. They are a poison. You need to keep them out of reach of children. They need to stay wet for 10 or 15 seconds. You will not have them effective on dirty hands. Remember, the dirt protects the viruses from a disinfectant, whatever kind of disinfectant it is. So if you've got dirty hands, they're not going to do much good. They will kill, alcohol will kill the coronavirus. It will not kill norovirus. And I'm far more worried about people eating norovirus than I am about them eating a respiratory virus. But that being said, alcohol will kill this. Do not buy the ones that are alcohol free. If they have what we call quats. This is one of the quats, or the natural ones. They are not going to kill viruses, and they're not recommended. So I will give you a minute to absorb my comic. My nephews are quite aware of my position on hand washing, and they sent this to me. And it gave me a really good laugh when I needed one in the midst of all of this. Unfortunately, I have no idea where it came from, so I couldn't include it in your handout. And yes, my son informed me that this might not be what T-Rex actually looked like, but I didn't draw it. So one of the things I talk to schools about and custodial and maintenance people as they're making decisions for cleaning and disinfecting is, what are you dealing with? This novel virus is a lipid envelope virus. These are the easiest to kill microorganisms. I think I just told you that soap will kill this. When you're choosing disinfectants, you choose them based on what you're dealing with. Most of your hospital-grade disinfectants used to be registered to kill tuberculosis, and most things below that, now they're going for the spores like the C. difficile. So here's your norovirus. These are non-envelope viruses. Those are the ones that cause the projectile vomiting and the diarrhea. Makes you want to die, but you usually recover in about 48 hours. Those are pretty hard to kill on surfaces. Microorganisms that we worry about that cause disease, influenza, we have a vaccine for that. If you don't want influenza, get a vaccine. Do all the things we're doing for COVID-19 as much as possible, but especially the hand washing and keeping your hands away from your eyes, nose, and mouth and covering your cough. But get a vaccine. Measles, that's a teeny tiny virus that floats in the air and it's highly infectious. If you don't want measles, make sure you've been vaccinated. Pertussis, whooping cough, is a bacteria. It's transmitted through droplets. You get it walking through a spit cloud. Everyone should be vaccinated against it. Adults will usually do okay, but you'll have a miserable cough for 6 months, but it can kill babies. So we really like everyone to be vaccinated. COVID-19, here's one picture. I love how we have different representations of this virus. That will be added to my list. Everything else has been on my list for a very long time of organisms we deal with in public environments. MRSA, that's a bacteria that causes skin infection and is the reason why we pay a lot of attention to cleaning and proper disinfecting in athletics and making sure the kids shower and change their athletic uniforms and not share towels and stuff. Norovirus, I've mentioned, that's an enteric. It causes diarrhea and vomiting. There is no vaccine because it's constantly shifting, which is why you get reinfected with it. It's the main reason why if you work in food service, there's no bare hand contact with food. Maybe if everybody's really washing their hands really well now with all the education around COVID-19, we'll actually reduce norovirus. C. difficile is another enteric bacteria that's caused a lot of illness in hospitals because it forms, the bacteria itself is pretty easy to kill, but it forms spores to reproduce, and those spores are hard to kill. So we do special guidance for that one. I am going to go pretty quickly through some of these other items. You've probably seen this. The SARS-CoV-2, the virus that causes COVID-19, floats in the air for probably about 3 hours, will live on plastic and stainless steel for up to 3 days. Copper, which has always been known to kill organisms, it's about 4 hours, and cardboard probably about 24 hours. Now these are lifelines or life times. That doesn't mean that after 2 days there's necessarily enough virus to make somebody sick. We still don't know how much virus you need to get sick. So these are pretty much maximums. So if you're worried about your Amazon delivery, leave it for a day and there will be no virus living on it. My rule of thumb is I assume nothing out in the world is free of microorganisms. So after I touch things, I wash my hands. Clean, sanitize, disinfect. That's what I'm here to talk about today. Cleaners, soaps, and detergents remove dirt and organics. If you do not do this, the sanitizers and disinfectants will not work. If you work in child care or food service, you know there's a lot of regulations around approved sanitizers. They remove the great majority of germs. Disinfectants destroy more. But there are levels of disinfectant depending on what you're trying to do. The main thing to know is that soap and water and cleaning is always first and always the most important step. And in COVID-19, it may be the only step you need depending on the circumstances and what you're dealing with. Sanitizers and disinfectants need to be EPA registered products. Gillian started off talking about the hazards. This has become a huge issue. We have a lot of asthma, and a lot of these chemicals and cleaners and compounds will cause people to develop asthma, and others will also cause asthma attacks. We have a lot of eye, nose, and throat irritation from these chemicals, to hormone disruption, and cancer. So we would like people to use safer products, starting with soap. Green cleaning means you're looking for products that are truly healthier for humans and the environment. They will put out less VOCs. I'm not going to spend time on this, but you'll have these materials. This is one study. We would really like VOCs, volatile organic compounds, to be under 500 in most environments, way under 500 if possible. But greenwashing is very common, especially during an epidemic, and claiming to be green on the front of the label does not mean that it's a safer product. You really need to look at the back of the label, and we recommend third-party certification. Where did my third-party certification? There we go. Sorry, we reorganized my slides. Third-party certification. If you use these labels, you will know you're dealing with safer products. So cleaning, remove the dirt. It will remove most of your microorganisms. Then you can disinfect if you need to kill more of them. For the novel virus, if you're in a public environment, you need to use a disinfectant that's on list N from the EPA. These are disinfectants registered for use against SARS-CoV-2. You can also use 70% alcohol or a bleach solution, and I'll talk more about that. There is an EPA program designed for the environment, antimicrobial pesticide program, that highlights safer disinfectants that have less. Do not mostly include products that can cause asthma, cancer, or reproductive hazards. So if you're disinfecting, after you've thoroughly cleaned and you use water to remove the soap, because a lot of your disinfectants, bleach especially, will not work through soap, you want the proper concentration. Always read the label. The label is the law. These are registered products. You have to allow the surface to stay wet for the required contact time. If it's not staying wet, it's not killing. Those advertisements that say you can spray a disinfectant in the air to kill things in the air are nonsense. You're not making contact to kill things. You're just putting a lot of chemicals in the air that are very bad for your health. Follow all the label instructions. Well ventilated. These are toxic compounds. You want to make sure you're using your ventilation system or opening your windows. Every product on the market has a safety data sheet. You can find them online, or if you're with a larger group that's buying these through a vendor, they should provide them to you. We work really hard to make sure that parents, teachers, and staff are not bringing chemicals into the school. It's the responsibility of the school or the child care to purchase those and to follow all the laws. If you're trying to clean sensitive items like keyboards, use alcohol wipes. That's probably one of the safest ways to clean them. So high-risk areas, athletic areas, bathrooms, health rooms, kitchens, all the high-touch surfaces, Floors do not need to be disinfected, but wherever you have vomit, blood, feces, or urine, you need to pay careful attention to removal, cleaning, and then the appropriate disinfectant. But just remember, you can disinfect these several times a day, but as soon as somebody touches them, they're not going to be disinfected. So again, it's most important that people wash their hands and not touch their faces. When you're buying products, it's important to know what products you're looking for. Alcohols are one of the safer disinfectants. You should not be using aldehydes. Our bleach we'll talk about. Iodine, nobody's using anymore. Hydrogen peroxide is one of the safer disinfectants. Peracetic acid is not. Phenols you should not be using. Quats are very common. They've been on the market for a long time, but they are one of the least effective disinfectants. They are in a lot of those wipes that are heavily marketed, but most people do not leave them wet long enough, and they are a leading cause of asthma. So I am recommending people avoid the quaternary ammonia compounds. Focus on the hydrogen peroxides and the alcohols. This is there for you to have as a reference. This is work done in San Francisco for those of you who need more information. These three products are all cause asthma: bleach, quats, and peracetic acid. Thymol is a botanical. It's a pretty low-level disinfectant and sensitizer, so I tell people avoid your botanicals and definitely avoid silver. I know it's popular in some circles, but it's really, really bad for the environment, and it's not a high-level disinfectant. Here's your safer product ingredients. You'll see more lactic acid and citric acid coming on the market. Mostly commercially, we're seeing hydrogen peroxide and the alcohols. These are the ones that can cause asthma. So I would highly recommend you avoid those. Again, these are your third-party certification. This is only for your cleaners. They cannot certify disinfectants and sanitizers. That's through EPA. So here's some more information on that I've already talked about. It's and the design for the environment will be your safer disinfectants. They look at all of these categories. I'm leaving this as a reference, not something I have time to dwell on today. Bleach, very popular, very common. It does cause asthma. It is very high hazard. If people use bleach, they need to be very careful with it. It is very effective as a disinfectant. If you're in a commercial establishment and you're mixing bleach for use from concentrate, the Department of Labor and Industries will require you to have an emergency eye wash. This has such a high pH that it can do permanent eye damage if it splashes in your eye. Never mix bleach with ammonia or acid. You can create a gas that will kill you. Happened not that long ago in a restaurant. It is not a cleaner. You must clean the surface first and remove the soap, and then you must leave it wet. Use your eye protection, use lots of ventilation, use gloves. This is the emergency eye wash directive for L&I for businesses. This is just for you to have as a reference about bleach. This is a new product on the market. I don't think it's coming out to homes, but it won't be long before it is. Sodium dichlor has been used in pools and spas for decades. They're now marketing it for indoor disinfectants. It is safer than bleach because the pH is close to neutral, and it's fairly effective, but it could still cause asthma. So you still want to be careful with it. If you're doing childcare, this is our childcare guidance. It's on my website, and it tells you how to safely mix bleach. The thing right now with bleach for COVID-19, CDC is recommending 1,000 parts per million and a 1-minute contact time. And the recipe for that is on our Department of Health childcare website. These are things that you really don't want in the environment. You do not want cake deodorizers. They're usually para-dichlorobenzene or sometimes naphthalene. Those are both incredibly toxic substances. Be very careful with the orange scented products. They're highly sensitizing. A lot of people react to those. They get real serious eye irritation, and asthma. So you don't want to spray these in people's faces, and you want to use correct dilution. Nano silver does not belong in the general human environment. It's really bad for the environment. Air fresheners are bad for human health and bad for the environment. Clean with soap and water and open your windows. Ozone should not be used. Ozone is a respiratory irritant. It's highly dangerous. I was just told that some ambulances are trying to use ozone to disinfect. Ozone is not registered to disinfect. You would have to use so much to actually kill this virus that you would cause a lot of human health problems. And this is lung damage, and you do not need people with lung damage being exposed to COVID-19, and it will disintegrate very expensive equipment. So forget the ozone. Fragrances, I've already talked about, they're bad for your health, and you do not need any antimicrobial products. These are very ineffective. It's a lot of marketing and bad for human health and the environment. Microfiber, if you pick these up, they are excellent for cleaning. You can use less chemicals and do more cleaning, and they help remove microorganisms from surfaces and then just wash them. And remember, you can wash your clothes with soap and water, and you killed your COVID-19. And please do not spray things in the air. It's not effective. It's not, there may be some registered products for hospital environments. That's a totally different situation. Hospital surgical rooms will do things that the rest of us should not be doing. So do not fog, do not spray in the air. Eileen's going to talk more about that. This is a study on the health hazards of some of these toxic products in childcare. This is what we tell teachers in case you're interested, where we're trying to have healthier cleaning environments. These are some resources. I didn't put the Department of Health and CDC because it's really easy to find us, and the URLs kept changing so much I couldn't keep them straight. I want to thank you very much for your time.
Nancy, thank you so much. I'm going to go ahead and move our audience to, we already see Denise, and we are going to try a live demonstration. Denise, you're unmuted, I believe. Why don't you go ahead and do an audio check? And for those of you who just see small Denise as opposed to human size, okay, if you put your icon up there, you can click on it and it will enlarge your screen so you will see Denise on the full size of your screen. All right, Denise, go ahead.
All right. Can you hear me okay?
I can hear you very well. Thanks, Denise.
Can I get an audio check that you can hear me?
Yes, I can hear you.
Okay. All right. So thank you all for joining me. My name is Denise Briggs. I'm with... All right. So my name is Denise Briggs. I'm with Blue Sky Services, and I'm a healthy home specialist. And for 29 years, I have been actively practicing in professionally residue-free cleaning and teaching it. There is a beautiful word about cleaning that of all times in our world, we need to know exactly how to use it. The good news is we all already know how to use it, but I'm going to take it from what we know and put it into your homes with products you already have in your house. This is so simple, so easy. So in 9 minutes, I'm going to teach you residue-free cleaning. So the benefits of residue-free cleaning are one thing. The first one is it is going to deactivate the virus by using soap and water, which is fantastic. 2, we're going to be removing everything we possibly can from the surface, leaving our surfaces residue-free. And 3, we're prepping surfaces prior to putting a disinfectant on, because as Nancy just said, if we're trying to put a disinfectant on a surface that is soiled, it will not be effective, and what we're ending up doing is having a false sense of security and a lot of chemical exposure, and it's not necessary because cleaning is incredible. And in this case, we are so lucky that this virus is fairly easy to deactivate. So here we go. So you think about cleaning. We've been being taught this over and over for the last 3 months about hand washing. That is everything we need to know about cleaning. So with hand washing, what do we have? We have soap, we have hot water, we have agitation, and we have time. That is the basic pie of cleaning: time, heat, chemical, and agitation. And then we have the next step, which is the rinsing and drying. So you think about, we get our hands, and what we're doing when we're washing our hands, we're dislodging, we're breaking away from the cracks and crevices of our hands. We're dislodging it, and we're suspending it in our hands. So that is what breaking surface tension is. That is the washing step. But you need to have the next 2 steps for this to be effective, which is the rinsing and drying. Because if we don't rinse and dry our hands, then everything will re-adhere to us, and then we just have more soap to go with our germs and viruses. So the rinsing and drying is the removal step. This is key to remember that, because cleaning is the process of removal. It's not the process of adding a chemical. It is actually the science of removal. So here's how we can do this so simply. We're going to be using what everybody already has in your house. It's dishwashing liquid. And I'm not specifically suggesting any specific type dishwashing liquids so much as I'm looking for something that is fragrance-free, and I also want something that is clear. We don't want any dyes, and we don't need dyes in clean. So dishwashing liquid. And we know how effective this is as a degreaser, something that will break down the lipids of this virus. By when we have an oil slick, what do we use to clean off all the oil slick from our birds and things? We use dishwashing liquid because it is very, very effective and it's safe. That's how powerful soap is. And the dishwashing liquid is something we all have. It's economical and it's highly concentrated. So what are we doing in here? So right now I have a sink full of hot water, just dishwashing liquid and hot water. Why do we want to use hot water in our cleaning? Well, if you think about having a dish that has grease in it, you're not going to add dishwashing liquid and cold water because you know it doesn't work as well. So by adding hot water, we're going to up the level of our cleaners. It activates them. It makes them work better. And then we're also going to use agitation, right? Because we need to break that surface tension. We need to move it away from that. So with the cleaning today, we're going to be doing microfibers or cotton towels. We want our microfibers and our cotton towels to be in good shape and to be highly absorbent. So if you have older towels in this work that we're using to protect and create healthy spaces, we want very good tools. So all I'm going to do is I'm going to put my washcloth in with this hot soapy water. And then I'm going to go ahead and take it on the countertop. So when you're cleaning, you want to keep your hand flat down to the surface. I usually fold my towel into 4 sides so I have cleaning sides to work with. So here we go. If I have my hand flat like this, I've got better contact surface, and that's everything we're doing is breaking, dislodging everything away from the surfaces. No matter what it is, we're trying to get it out away from the surface. So when I'm cleaning, keeping my hand flat, I'm going to move in a grid-type pattern, up and down, side to side. If I'm doing it in a grid-type pattern, I'm following a rhythm and a system to make sure I have full coverage. If I want to do a deeper clean, I flip it and I do another round of cleaning. I don't want to wrinkle it all up because when I have a rag that's wrinkled up, I'm not going to have the same surface space. So right now I have a countertop that's got wet. It's got probably dead viruses and germs, and it's got soap, and who knows what's on this countertop. If I leave it to sit at this point, what it's going to do is going to dry on here, and I'm going to have what's called a biofilm, which is going to make it so it'll kind of attract more bacteria, but it's also going to make it, if I'm going to use a disinfectant, not as effective. So now is the most important part that we add into this step. It's the rinsing and drying. These are the removal steps. So you think about washing your hands, you have to rinse them using agitation again and then dry them. So the same thing, flat microfiber or cotton towel, back and forth, side to side. If you want to do an additional rinse, go ahead and flip it. And then we're going to dry this towel or dry this countertop. This countertop is so clean. You're going to be amazed by the system of how well it cleans with just basic dishwashing liquid, hot water, soap, agitation, and a good system of time. It's incredible. So this works amazingly well if you have a hot sink or a sink with hot soap and water. but you don't always have that you can take anywhere. So I'm going to show you how to do this portably now. So if you get a hot or a spray bottle here, fill it up with hot water and add your dishwashing liquid to it. 1/4 or 1/3 teaspoon to a 1/2 teaspoon is fine. And always label your spray bottles. Now I have another another washcloth here. I'm going to spray this into the washcloth. Notice I'm spraying it below my face. Never ever spray cleaners above your head, especially disinfectants, especially aerosols. They are not meant to go into our lungs, so always be very mindful of your products. And here we go. We now have something we can take this system on the road. So what are we going to focus on with this cleaning right now? We're going to be focusing on our high touch points. What is a high touch point? It's things you touch. Things you touched from your family. So the things that we're touching all the time in our family are like countertops and sinks and doorknobs and light switches and handles and remote controls and cell phones and your desk and your keyboards. You know, it's not so much about memorizing everything you touch. It's about being aware of what you're touching. Just pay attention, because the areas that people touch the most is going to have the highest concentration of the germs and the viruses. That's why we focus on that. So little things. So here I've got this towel of hot soapy water. Coffee pots and hot pots, notorious for having high germ count because we don't think about it, right? That's why we have to be paying attention here. So I'm going to take this microfiber, or if you have a cotton towel, either one. This is wet. I'm going to thoroughly be wiping it over the surface. Again, if I want to do another round of that, go ahead. And then I'm going to add that removal step of rinsing it and then drying it. So simple, so easy. And then because we have a virus that's extremely contagious, so at this point, oops, I am done with time. So at this point, when I'm done, I'm going to go ahead and put these two in hot soapy water. So that way I'm deactivating any viruses, or go ahead and put them in the laundry so that they're not recirculating in the house. So again, my name is Denise Frakes. This is easy residue-free cleaning. Washing, rinsing, and drying, and you're good. So everybody be safe out there. Thank you.
Denise, thank you. You are a true resource. Appreciate it. Everybody, we're going to go ahead and make a leap right now. Eileen Gagne is going to follow up with reading labels of disinfectants and safe use. However, she got bumped off, so we're going to try to put her on. I'm going to pull up her slides myself, and we're going to try to put Eileen on through a speakerphone. And so give me... Oh, Eileen?
Yes.
Okay, I just heard you clear your throat on the webinar as well. Or maybe did somebody else clear the throat? Eileen, I think your audio may be on there as well. Okay, I'm gonna do me a favor. Eileen, go ahead and start talking, and let's see, I've got your safe and proper use of disinfectant slides up.
Perfect. All right, thank you.
And hold on, let me just make sure. Yep. Okay, go ahead and talk, please. We're just testing.
Good morning. Can you hear me?
And if somebody can give me a wave or a shout out or a text that we can hear Eileen this way. Anybody who's on my text system right now, let me know that we can hear Eileen.
Eileen, this is Andy. I can hear.
Beautiful. Okay. Thanks, Andy. Appreciate it.
Beautiful.
Okay. All right.
Well, okay. Good morning and afternoon. Welcome, everybody. I'm Eileen Gagne, and I'm the technical advisor and trainer for the Tribal Healthy Homes Network. And my apologies for the phone. However, I just wanted to give you a little background. So for the past 40 years, I've been in thousands of buildings, whether they be homes, businesses, or child care centers. And as part of my training, I educate folks on household products. And with the COVID-19, my concern is that not only some of our products are being used inappropriately, and there's a lot of misinformation going on the web. So that's one of the reasons why we want to do this webinar. So I'm going to start, and Gillian, if you want to go the next slide.
Okay.
So on this slide, you see types of sanitizers and disinfectants. There are so many different products out there. It is so confusing on what to use and when to use them and how to use them. So, next slide. So there are really good distinctions between conventional products, such as the household bleach that you see here. With bleach, it is a lung irritant. You please read with any chemical you use. Read the label and follow the instructions. It's crucial, okay? For most products, it would be best to allow proper ventilation, and especially with bleach, never mix it with other household products, chemicals, and especially ammonia. With bleach, you have to leave it on the surface for 1 minute. That is called its dwell time. And it looks like you have to rinse it after use. And I've included on that slide the dilution rates that you can use. Next slide. So here you see, you want to prepare the surface. 2, 3, sorry. There are distinctions. There's also the safer choice products. So, and that's an EPA label that has come forward, and there's lots of great articles for that. Now, next slide. What I've chosen to do in this particular webinar is actually look at one product that a lot of people use, and these are disinfecting wipes. And first and foremost, you have got to read the label. And as you can see, it gets quite small. Next slide. And it's about a 6 font. And one of the things that you'll see on that label for these disinfecting wipes is what we call is a dwell time, or how long it has to stay on the surface in order to work appropriately. That says 4 minutes. Now that's a lot of time, so just be aware of that. Okay, next slide. First things we wanted you to do is take necessary precautions when you use any product. Okay, open the windows and put on your gloves. Next one. Then you want to prepare the surface, and a lot of products will say if the surface is dirty, you have to clean with soap and water first, rinse and dry it. So most of these disinfectants, if not all, will not work appropriately or well if there is any kind of soap or grease or actually other disinfectants on the surface. You've got to clean it all off. Next. Then once again on step 4 it says follow instructions carefully. Open the container, you've got your gloves on, and close the container, and you want to make sure that that container stays closed, because if it doesn't, it can't, all those fumes and all those disinfectants that are in the container can get into the air as you work. Next one. Then you want to leave the surface. You want to use as many wipes to leave the surface visibly wet for what they call the required contact time. And it can range from anything from 15 seconds to 10 minutes, okay? In this particular case, with this particular product, it is 4 minutes, right? So you have to time it, and then when you're done, throw the wipe in the trash and in the garbage. Never put these wipes down the toilet. They will clog sewer and septic systems, and then you've got a whole other problem, okay? After you're done with the wipe, next slide, you want to remove your gloves and discard them also in the trash. If you're using reusable gloves, you want to put them in like a zip or some kind of bag where they can be reused for just that particular chemical. Next slide. So once you are done with that, for surfaces that may come in contact with food, so these are your kitchen counters, anything like that, a potable water rinse is required. So once that product has dried on the counter, then you have to actually remove it with water and then actually dry it. And then once you're done with that, you want to wash and dry your hands. So next slide. That's the simple technique. It's not simple. Actually, it's quite complicated, but it takes many, many steps in order to use these products correctly. And that's it for my time. And next slide. There's my contact information. If anyone has any questions, please feel free to email or call me at any time. I am happy to help. Thank you. Thanks, Gillian.
Thank you, Eileen. All right, everybody. This is interesting. We're moving along, and we are now going to go. Thank you to all the expert panel. We're going to move to our federal agency expert panel now. And again, as you can see, there's issues with displaying this. And I'm going to go ahead and start with Anita Pease, Director of Antimicrobials Division, Office of Pesticides Program, to talk about List N. Bios, by the way, for everyone you're hearing today, they're a handout at the bottom of your screen. And Anita, I believe you are good to go. I don't hear you yet, but go ahead and take it away. And
yep.
there
Can everybody hear me?
Hear you great. Yeah.
Can you hear me?
Yes, we can hear you.
Hello?
Great.
Can you hear me?
Yes, Anita, I can hear you.
Can you hear me now?
Yes.
Okay, great.
Okay.
Hi, everyone. So thanks for the opportunity. Okay, great. Thank you. So thanks, everyone, for the opportunity to participate in today's webinar. Okay, I'll start again. So I just want to reiterate, I just want to thank everyone for the opportunity to participate in today's webinar and talk about how to use these disinfectants safely and properly to reduce the transmission of new coronavirus, which is a virus that causes COVID-19. So before I start, I really just wanted to briefly describe, before I get into List N, I wanted to briefly describe EPA's role in the ongoing COVID-19 pandemic. So for those of you that aren't familiar with our part in this, we are operating under the Federal Insecticides, Fungicide, and Rodenticide Act, which is the law, or it's often referred to as FIFRA. This is a law that gives EPA the authority and the responsibility to regulate any product used to kill pests, or what we commonly refer to as pesticides. So in addition to those types of traditional pests, insects that we commonly associate with pesticide use for organisms that can't be seen with the naked eye, including bacteria and viruses and fungi, are also considered as pests. So the Antimicrobials Division in EPA's Office of Pesticide Programs is responsible for registering these types of products called antimicrobial pesticides. So we basically regulate products that are applied to objects or surfaces. As some of the past presenters have noted, these are your high-touch surfaces, your countertops, and those are the types of products that our disinfectants work against. For those products that are used on humans, such as drugs, medical devices, and cosmetics, or hand sanitizers, those are regulated by the Food and Drug Administration. So I just wanted to make that distinction right up front. So moving into List N, let's just go ahead and advance the slide. So this is the website link to List N, which is our disinfectants for use against SARS-CoV-2, which is the actual technical scientific name for this novel coronavirus that we're dealing with right now. And we published our first version of this list on March 3rd. And basically what it includes all the disinfectants that are effective for use against this novel coronavirus. So all of the products that are included on this list have been approved by EPA, and we have data that demonstrates their effectiveness, or what we call efficacy, against a virus that's either similar to the novel coronavirus or something that's harder to kill. Earlier, you saw a slide that showed easier or harder to kill viruses. So that's a great slide to go back to. If we have data on a virus similar to this novel coronavirus or one of those harder to kill viruses, those are the types of products that would be on this list. So basically that means that we reviewed that data and it shows they're effective against this SARS-CoV-2 virus. So back in 2016, after the Ebola outbreak, which I'm sure many of you remember, EPA implemented a guidance called the Emerging Pathogen Guidance. And that was really developed for this exact situation that we're facing today. And this guidance basically sets up a pathway for registrants, or we call them registrants. These are basically the companies that manufacture the antimicrobial disinfectants on this list. It sets up a pre-approval pathway for them to make off-label claims for new types of emerging microorganisms like the one we're seeing now, because they already have data showing that their products are effective against a harder to kill virus. So as soon as there was the outbreak in Wuhan in China, EPA triggered the use of this guidance for the novel coronavirus, and we triggered that on January 29th of 2020. So since then, EPA has really been working round the clock. A lot of my staff are just putting in a lot of extra hours. We've been implementing that guidance, and we've been continuously expanding all the chemicals that you see in front of you in this table on this list. And these are all the disinfectants that can be used against the novel coronavirus. Since we first put this out in March 3rd, we've updated this list 4 times already, and I believe another update to list N is coming out today, this update. And we are routinely updating this list weekly, every Thursday. So you should see more products get added to this list each week. Right now, we're upwards of 350 products that are on the list currently. So in addition to expediting these emerging viral pathogen claims, EPA is also starting to expedite other types of actions for currently registered products with new data, new products, and also we're looking at a way to address some of the supply chain issues that we've been hearing about. One thing to note is that this novel coronavirus is a new pathogen. So none of the chemicals on this list have been tested against the new coronavirus. However, we know that labs are just starting to get the virus in, and we do expect some data to be submitted to us in the May and June timeframe. So what you'll eventually be seeing are products on the market that will have a specific labeling statement that they are effective against this new coronavirus. Right now, you won't see that in any of the products that are currently on the market. So when selecting a product to purchase, I think a lot of this has been discussed already in some of the great presentations earlier. Just please ensure that the label has the EPA registration number that's noted in the table. We've been making improvements to the table each week. So all these fields are searchable, so you can type in the registration number in the search column to ensure that the disinfectant you're using is on list N. Please also note that for the product to be effective, again, this has been mentioned earlier, the surface does need to remain wet for the contact time noted in the table. So if you see there's a column here for the contact time, so that's the contact time you should be using for the particular product. But again, the label is your best bet to follow for that. Finally, I'll note that this website that you're seeing right now includes some FAQs. Perfect. So we're clicking on that now. So these are frequently asked questions. I'd encourage you all to look at these questions that we get. These are the most common types of questions we get about the list, but this is a living document, and we will update it as needed to address questions that come in. And we keep getting different types of questions every day, so we will be updating this on a routine basis. If you have questions after today's webinar, if we can go back up to the table, go back, and then scroll to the bottom. Yep, keep scrolling. Yeah, so at the very bottom, you'll see a contact us. There's a contact us link right there. You see that on the left?
There we go.
Yep. So if you click on that contact us, that will take you to a web page. Why don't we go ahead and do that?
Yep.
Okay, so at the very top here, you'll see contact us about a pesticide registration. And then it says, before writing us, please see our registration website and manual. If you still email the appropriate contact for, and then there's hyperlinks to conventional, antimicrobial, and biochemical, you want to click on the antimicrobial link there in the very first paragraph. And that will take you to an email that goes straight to us to check daily. So if you have any questions, you want to get in touch with us directly, that's the best way to do it. So in closing, I'll just give you some key takeaways. Use the products on list N to disinfect surfaces for SARS-CoV-2 or the novel coronavirus. Read the label and follow the directions for use based on the virus and the contact or the dwell time indicated on list N. Please don't use these products on your skin. A lot of people think that just because it's a wipe, they can use these things to wipe their hands. You should not be using these products on your skin. Again, FDA issues those types of products. And contact us if you have questions. Please beware, in working through this crisis, we have observed that there has been some commercial mischief. So there are a lot of bogus products out there that are making claims that they should not be making. So you really need to make sure you check that EPA registration. And I'll just close by saying, please be smart, use Listen, wash your hands, and stay safe. Thanks.
Anita, that's fantastic. Thank you so much. It's good to know that EPA is working on this, and yeah, they're very clear and very helpful. I'm going to go ahead and move right to Amy Kirby. And Amy, I believe you should be unmuted, but I think I heard you come on.
Yep, I'm here. Thank you for inviting CDC to participate in this webinar today, Gillian. We really appreciate it. A little bit of who I am. So I'm an environmental microbiologist, and I am on the water sanitation and hygiene team for the response that's part of the Community Mitigation Task Force. And so that task force has been developing all of the guidance for how you can prevent the spread of COVID-19 within the community and what you can do in your home to keep you safe. And specifically, the WASH team within that task force has had the job of developing all of the cleaning and disinfection guidance that we're going to be talking about today. So we can get the next slide. So I want to give you a little of the general guidance that we're advising for people at home and in the community. So we've talked about this quite a bit already today, so I won't spend a lot of time. As others have said, this virus is thought to spread mainly from person to person and primarily through respiratory droplets. So those are the droplets that are produced when an infected person coughs or sneezes. And we think those droplets stay in the air for can travel about 6 feet before gravity brings them to the ground. And that's where we get the close contact definition of someone who's within 6 feet. And our social distancing guidance to maintain that 6 feet bubble, as I believe Nancy was talking about earlier. The droplets can infect someone when they land in your mouth or nose, or they're inhaled into the lungs. What we're worried about on this webinar today is the droplets can also contaminate surfaces. So if they land on surfaces, the virus can survive there for hours or in some cases up to days. And other people can then pick up the virus by touching those surfaces and then touching their eyes, their nose, their mouth. Next slide, please. Okay, so what can you do? Avoid touching your eyes, nose, and mouth with unwashed hands. Again, as someone said, you can assume that everything is contaminated, and so when you touch things, your hands potentially become contaminated, and you don't want to then touch a mucous membrane, a wet surface, your eyes, your nose, your mouth. Avoid close contact, again, that 6-foot bubble with people who are sick. Stay home if you yourself are sick. Practice what we call respiratory hygiene, so cough or sneeze into a tissue or into your sleeve if you don't have a tissue on you, and so just out into the open. We really, as others have emphasized, washing your hands is a great preventative, not just for COVID-19, but for a whole host of infectious diseases. You want to wash your hands with soap and water. Again, don't worry about whether or not it says antibacterial. All soap is antibacterial and antiviral. So just get some soap, wash your hands for at least 20 seconds. So singing the happy birthday song twice. If you cannot get to soap and water, you can use alcohol-based hand sanitizers that contain at least 60% alcohol. And as we'll talk about in more detail in just a minute, clean and disinfect frequently touched objects and surfaces. Also want to note there that we do not have a specific treatment for COVID-19. And so the treatment for this is really supportive care, management of symptoms and management of the complications of pneumonia and respiratory failure. Next slide.
There we go. A little bit of a lag.
There we go. Okay. If you yourself get sick, the most important thing you can do is stay home. Most people who get COVID-19 can recover at home without any medical care. Stay away from other people as much as possible. So, isolate yourself from the people that you live with as much as you can. Keep your distance, cover your coughs and sneezes. Wash your hands frequently. Encourage the people that you live with to wash their hands frequently. Avoid sharing personal household items. So think about the things that we all touch, remote controls, if you share a phone, light switches, things like that. You want to limit sharing and shared contact of those things. Again, clean and disinfect frequently touched objects, and we'll talk about that more in a minute. And monitor your symptoms for emergency warning signs, particularly if you have trouble breathing. If you are having severe trouble breathing, do not delay. Seek medical care, but please call first so that they will know to expect you and tell them that you are having trouble breathing and you think you might have COVID-19. One of the questions we get frequently is, how do we know when we can stop home isolation after we've had COVID-19? And so that's what's there on the right. I want to focus first on the lower part. So if you have not had a COVID-19 test, so you have all the symptoms, but you were able to ride it out at home and you didn't get tested, when can you leave isolation? You want to have no fever for 3 days, 72 hours, without fever-reducing medicine. So not plus Advil, no fever at all. And your other symptoms have improved, and it's been at least 7 days since you started having symptoms. So you're going to be on isolation for at least 7 days or longer if it takes longer for your fever and symptoms to resolve. If you have had a COVID-19 test, it will be all of those things, plus you will be tested negative twice, 24 hours apart. Next slide. Okay, so cleaning and disinfection. Our guidance is very similar to what you've already heard. We're very lucky that COVID-19 is a virus that is pretty easy to kill. So common household cleaners and disinfectants are effective. Again, we refer to EPA's list N, so look there. But when you go to that website, you'll see that there's a lot of things that you're used to using in your house on that list. So you probably have what you need already. Again, follow the label instructions for use, especially the dilution that you need to use it at, the contact time, as people have said, how long does it take the surface to be wet to get appropriate kill, and wearing the appropriate protective equipment. Do you need to be wearing gloves is usually the concern for disinfectants. And I want to go back to the dilutions for use. A lot of times people think, you know, if a little is good, a lot is better. In the case of disinfectants, that is really not true. Use them at the dilution that is recommended on the label. If you can't get a hold of one of these list-in disinfectants, household bleach will work. You can dilute it. It's 1/3 of a cup into a gallon of water. I saw someone else write it as 5 tablespoons into a gallon of water. Those are roughly the same measure. When you're cleaning, you really need to focus on high-touch surfaces. So again, think of these things that everyone in your household is touching. So the remote controls, the toilet handles, the faucet handles, the light switches, doorknobs. Those are the things that need to be disinfected frequently. You know, surfaces like floors, not so risky and not something that you need to be focusing on. And as others have pointed out, if the surface is dirty, you need to clean it before you disinfect. Next slide. If someone in your house is sick, there's some modifications to this cleaning and disinfection guidance. Ideally, you want to separate the sick people from the well people. So we recommend that you set up a sick room where the sick person can stay and isolate themselves from the rest of the household. If possible, also set up a sick bathroom because we want them to, you know, keep the germs in their bathroom, not the shared bathroom. If you are able to set up sick rooms and sick bathrooms, those rooms should only be cleaned as needed. You should not have caregivers going in there and cleaning them every day because it's increasing the exposure that the caregiver is seeing. So as needed means, you know, so if the sick person has an accident or they spill something, then you want to go in and clean. But just, you know, as daily cleaning, that can wait until they're out of isolation. When you're in the room, when the caregiver's in the room with the sick person, that person should wear a cloth face covering because, again, the goal of the cloth face covering is to protect, to limit the transmission from a sick person to a healthy person. So we talk about the role of face coverings is I protect you, you protect me. So it should be the sick person wearing it. And after the sick person has recovered, there could be respiratory droplets in the air that are infectious, so we recommend closing off the sick room, opening windows and doors, airing it out, and waiting up to 24 hours if you can before going in and cleaning and disinfecting that room and returning it to use. Last slide. So this is just a list of some of a small number of the resources that are available on our CDC website, I wanted to point you towards a few that I thought might be particularly of use. So the top one is our general landing page, the www.cdc.gov/coronavirus. From there, you can navigate to all of the resources that are available on cdc.gov. A few of the things that might be of interest, particularly to this group, we have a page for preparing your home. So not just cleaning and disinfection, but also, preparedness plans and how to deal with school closures and all of those kinds of things that come along with getting your home ready for this particular outbreak. We have guidance for how to care for someone at home. So I've given you some of the high points in that last slide, but there's a lot more information available on that caring for someone at home page. We have guidance on hand washing. That is the very best thing you can do. Hand washing and social distancing are the key to this. And we have a whole website dedicated to hand washing with lots of great videos and directions and things to encourage kids to wash their hands. I encourage you to look at that if you're interested. There's a page on cloth face coverings. So if you have questions about why we're recommending that or how to use them or what qualifies as a cloth face covering, you can go to that site. And finally, we get a lot of these questions about workplaces as well. So if you have a business or you work for a business, this is a great site to get some information on how to protect yourself, how to protect your employees, and how to protect your customers in the face of this COVID-19 pandemic. And with that, I'll close, and hopefully we can take questions at the end.
Amy, thank you. I'm really glad CDC was on. I'm pleased to see the consistency and the thoroughness of the guidance. That was excellent. Thank you so much. And again, all these links and handouts are going to be available after the webinar. I'm going to move right along. We are running over time, but we're going to keep going until anybody needs to leave, eat lunch, come back. But we've got, we're moving into Indian Health Service, Northwind Indian Area Indian Health Board, sorry, and then tribal and indoor air resources from EPA. So let's keep moving right along. And Celeste Davis, I'm going to do an audio check. Looks like you're unmuted.
Yes, can you hear me?
Yes, and we are moving to your slide. There's just the leg, and there's your introduction. Please feel free to jump right in. I'm going to go right to your link slide.
Okay, great. Hello and Chukma to all my friends out there. I want to thank Gillian and all the presenters who have wonderful information that we've had so far. And the primary information that I wanted to share with you all today was that the Indian Health Service and the Northwest Portland Area Indian Health Board are collaborating very closely on the COVID-19 response to help our tribe. So I wanted to let you all know that we are here. We are here to help. And we are looking at providing clinical guidance, community resources, and tools and messaging for communication purposes around the COVID-19 pandemic. Also, just of note that we are following all CDC guidance, and we also reference the EPA list of registered disinfectants. So all of the information that's been presented so far falls directly in line with what we are wanting to share with you all. And if we could maybe look at some of the links here. This is the only slide I have, and I wanted to just share with you that the Indian Health Service has also on their main coronavirus landing page, there are some particular,
there we go. Sorry, Celeste.
Yeah. No, that's fine. And we'll be brief here. I wanted to highlight just a few of the materials that have been developed on the Indian Health Service page that are available. They're available as PDFs for you to download. And there's in fact a fillable PDF that you could use and put your tribal health clinic name, a program name, or just simply the tribe's name if you wanted to share and post the information. 3 particular items under the COVID-19 materials developed for tribal use.
Yeah, would you like me to click on that?
Sure, yeah.
Just might get it closer. Oh, All right. Beautiful. There we are.
Yeah, so these were developed specifically for the Indian Health Service, and they're very well done. They're nice graphics, and we have how to prevent the spread of COVID-19 in the home, simple practical advice, tips for elders and their caregivers. We know that is very important. And then another is what tribal members need to know about COVID-19. And that particular resource is the one that I mentioned, that there's a fillable version off of the Indian Health Service website that that tribes can use to make it fit their needs a little better and specify it to their tribe. And the Northwest Portland Area Indian Health Board, we also have a wealth of resources on our webpage. And yes, and also kudos to our team who have been updating our web page, done a great job themselves. And so I wanted to encourage you all to go to our website. We have you'll see there a link directly to the CDC information. Somewhere within all of that is also a link to the list N of disinfectants from the EPA. And just a couple in particular that I wanted to highlight for you all. There's the Indian Country Echo down at the bottom, tele-echo learning sessions. Those are available for people to join and understand what's going on from the clinical side of things. Tips and resources for community messaging about COVID-19 is more specific to the point of discussion we're having today about cleaning and disinfecting in the homes. And we do have a link to a message and a video from Michigan State University, who developed a video about how to make a disinfectant solution using bleach, because we know that's the practical thing that's available out there for a lot of our tribal homes. You know, that's one thing that a lot of people will have. So we know that we want to make sure that you know and understand how to make the solution properly, the proper protective equipment you should use, all of the things that Eileen and Nancy and Denise just presented, all of that information. And then if we could go back, there's one thing in particular that I wanted to, the last link there, one of our, the best, I will say the best efforts that we've produced from the board is our communications piece. And those of you in Indian country, you know, and I'm an auntie myself, so we have a great resource called Ask Auntie. And so we created one specifically for the COVID-19, and it's really good. You know, if your kids aren't listening to you, they might listen to Auntie. So it's really good. So those are just some items I wanted to share with you all. And I just wanted to let you know that we're here. So reach out to us, and that's it.
All right. These are really good resources. Thank you, Celeste. And I love this. There's so much right now that we would not have known that you'd develop these very specific and culturally relevant. These are terrific. So we look forward to sending those out to the communities as soon as the webinar wraps up. All right, we are now going to go to Nate McMichael because we're shifting a little bit. The next 3 or 4 presenters as we move towards the last section of it is talking about what EPA and what certain tribal organizations can provide to both the general public as well as to tribal communities around other indoor environmental resources. Again, I have to iterate, we are sequestered at home right now due to the coronavirus, but we also are sequestered at times due to climate-induced events. So the indoor environment, I cannot underestimate enough how important it is to be thinking about that as an ongoing health threat to you and your community. And let's see, Nate, are you unmuted? Let's see, where are you, Nate? There you are. Make sure I don't have you muted. I think I did. My bad. All right, we should be able to hear you.
No problem. You should be able to hear me now.
Nice and clear.
Okay, great. Well, thank you, Gillian, for the introduction, and I know we're running a little late on time, so I'll be pretty brief here because, and I can partially do that because you, Nancy, and some of the other speakers have already done a great job giving an overview on why indoor air quality is important and how the concerns that we look at in the indoor environment are relevant in this situation. I just want to start by saying that the resources that I'm going to describe are indoor air quality specific, but they're not COVID specific. EPA's COVID resources are on our our coronavirus website that Anita mentioned earlier, and that's epa.gov/coronavirus. But the resources that I'm going to briefly talk about here are applicable in any situation. If you're like me, you are spending much more time at home now than you ever have before. I enjoy going out to check the mail because it's one of the few opportunities that I have to go outside every day. And I'm sure a lot of other folks are in the same boat. So the slide that I have up here is an overview of EPA's indoor air quality resources. There are more URLs, more links, but I thought that this was a good overview. If you have one takeaway item from this, it is to go to epa.gov/IAQ for our indoor air quality resources. Broken it down here into a couple of sections. We have information relevant to homes, schools, and I also put in a plug for our indoor air quality partnerships, our tribal partnerships specifically. So please go to epa.gov/IAQ to learn more about that. Can we go to the next slide, please?
Yep.
So here's just a quick example of some of the types of resources that we have available through our website. You can find information on what you can do for reducing asthma triggers in homes and buildings, preventing and controlling mold, learning how to control mold through moisture control and cleaning up mold, information for community groups, for folks who work with communities and promoting healthier secondhand smoke reduction activities, encouraging information on encouraging folks who do smoke to take it outside and not smoke in the house. Also information on ventilation systems, proper use and maintenance. And then a big one on our website is radon. Radon is a gas that causes 21,000 up to 21,000 lung cancer deaths each year, and the only way to know if your home has elevated radon level is to test. So information on how to do that and keep your home, the air in your home healthy. And with that, I'll give you the time back because as I said, I know that we're running over. Just a reminder, epa.gov/IAQ for all of our indoor air quality resources.
Great, thank you, Nate. And you have, I do encourage people to call Nate, call the Indoor Environments Division. They're a small division with the EPA, but they have an outsized task and challenge, and they're very resourceful. And your EPA regional coordinators, tribal and non-tribal in the air programs, usually have a lot of resources and they're pretty well connected. So please use their resources. Yeah. Oh, sorry, go ahead.
No, I was going to say that's absolutely right. And information on contact information for our regional counterparts is also available through our website that I mentioned.
Okay. Thank you, Nate. Appreciate you participating. Enjoy your walk to the mailbox later today. And I'm sure we all will. And I believe Andy Bessler is up next. And let's see if you are.
Yes.
Hi, Andy. All right, take it away.
Great. Thanks, Gillian. And greetings to everyone out there across the country. It's an honor to be on the call today. The National Tribal Air Association is who I'm going to be talking about to introduce you to opportunities to engage on indoor air quality and ambient air policy. The National Tribal Air Association, I'm based out of Flagstaff, Arizona. We're an EPA partnership group housed at the Institute for Tribal Environmental Professionals. and we advance air quality management policies and programs for Indian country as well as Alaska Natives. We're one of the largest tribal organizations in the nation with 151 federally recognized member tribes. Next slide. This is a screenshot of our website. We've got several different areas of work we do on air quality and climate change policy. I urge you to visit our website so you can learn more. One of the big things we do is a weekly update. So every Wednesday we publish a document that has all the latest news, resources, funding sources, webinars, calls coming up for that week as it relates to tribal air quality programs, both indoor and ambient air. Most importantly, I want to highlight our indoor quality work group. We meet on a regular basis to see how we can help advance indoor air quality for Indian country. It's tough because for EPA, it's a voluntary program. They don't have regulatory programs like with ambient air quality. So we try to find ways to advance that work. Next slide. So I do invite you to join our indoor air quality work group. This is for folks working for tribes. Also, EPA folks join us, other federal agencies join us. But we meet every other month, so our next call is on Thursday, April 16th at 2 p.m. Eastern. And information on how to join is on our website and in the NTA weekly update. One of the interesting things we're doing is we're working with Housing and Urban Development's Office of Lead Hazard Control and Healthy Homes to publish 4 tribal healthy homes guidance documents. These are a lot of the information discussed on today's webinar will be in a published document for 4 different audiences. One is for housing professionals. Another document is specifically for tribal leadership. Another document is specifically for the general public. And then a 4th document is for medical professionals working in tribal communities. So these 4 documents are going to be published very soon. And we've been working with HUD to make it culturally relevant and also help get it published online and through a mobile application. So we're going to be talking about that on our call on Thursday, April 16th. So if you're curious to learn more, please join us. And our web link is there below. So thanks, Gillian, again for the opportunity. And I really appreciate Tribal Healthy Homes Network's great work across the country. And thanks to all the speakers.
All right, Andy, thank you. Let's see, I'm going to move on to Mansell. And again, the links that Andy showed you in the work group, you can reach out to anybody on their team and we can connect you. And Mansell, let's fingers crossed that your audio is good and we can hear about your organization and your work.
Thank you, Gillian.
Beautiful. We can hear you.
Go ahead, next slide.
Okay.
So I'd like to welcome you to the Institute for Tribal Environmental Professionals. This is a screenshot of our website. We are focusing on working with the 574 federally recognized tribes in a lot of different ways, including indoor quality. Next slide. This is our indoor quality website. Again, it gets screenshot with a URL, and we'll have various resources that are on there. We'll be adding more resources. Again, next slide. Thank you. We do have, we're of course not able to do in-person trainings at the moment, which is one of the big programs that we have. But this is our training website, and we do have a number of online trainings, and we're working on adding some more. We're open to suggestions and requests on various topics that we might be able to address. When Gillian approached me about working on this particular webinar, I knew it was very timely and needed, and we're willing to work on others as well. Thank you. Next slide. And also want to mention that another area that I work in is working with our youth and with teachers, environmental education. And so this is a screenshot of our website. I know there's a lot of parents at home with kids in homeschooling situations. They might get some assistance from their school, but you might be looking for other things, and feel free to reach out to us for additional resources. Thank you.
All right, and if you go to Mansell's website, they also do trainings around the U.S. on indoor and ambient air, and they'll also customize trainings. So highly recommend working with them. I'm going to, before we go to questions, I'm going to briefly describe, like in 30 seconds or less, Tribal Healthy Homes Network. Here's our URL. The two reasons I would drive you to our website today, I'm not going to talk about our organization, but as far as resources around indoor air, there's two slides or two screens. One is you can see that we have a database. So you type in any issue, wood smoke, mold, asbestos, radon, IAQ, you can click on that. And we have a repository of either tribally custom or for general public materials, education, outreach, technical assistance type guidance on each of those topics. And probably our strongest and most current resource is a very comprehensive indoor air funding directory for everyone on this call who is not from a tribal community. Feel free to use this because it isn't specific to tribes. It is created for tribes, but you can go in and search by topic, by type of grant, by agency, and it will essentially extract for you whatever meets your search criteria. And it gives you from housing, weatherization, community home visit programs, it gives you that full range of potential grants. So it's a good resource. We're going to go to questions. I just tried to click down. Before we go to questions, two things for those of you who might need to go to the mailbox. Okay, number one, if you would like a certificate for participating today, please email us. When we will send out a recording of this and the slides, but if you'd like a certificate, we're happy to provide one. Number two, my ask to all of you is that we make this a domino effect in that you share the recorded version with your colleagues, your other departments, agencies, partners, families, aunties, elders. You will literally help potentially prevent a poisoning, an asthma attack, and potentially transmission of COVID-19. So I think my request is please keep today's resources. If you found it valuable, please keep that moving forward. And with that, Mansell, if you are still unmuted, we're going to go ahead and try to facilitate questions. And let's see here.
Do you want me to go ahead, Gillian, with a couple while you're...
Would you please, because I'm a little dyslexic when it comes to properly reading the question box, yeah,
Sure,
or I
no
can't
problem.
open it. So please go ahead.
There was a number of questions, and this is for all of our panelists. There seemed to be a number of questions about the discussion on soap and some soaps having antibacterial agents in them. People were concerned about, did it need those antibacterial agents? Why do we recommend not having them? Is the soap still effective? So any of our panelists that could address questions about soap and the antibacterial would be helpful.
This is Nancy. Can you hear me?
Yes, Nancy.
Okay, soap by itself is considered somewhat antibacterial. The key thing is you don't need to buy soap that claims on the label that it's antibacterial, because that means they've added quaternary ammonia compounds in general now. It used to be triclosan, but FDA pulled triclosan out of consumer products. Those ingredients are asthmagens and endocrine disruptors, and they're not good for your health or the environment. So you don't need an antimicrobial soap, you just need a plain soap. And as I said, preferably dye-free, fragrance-free. The soap itself, because of its nature, will deactivate the lipid envelope viruses like COVID-19 if it's in contact with it. But the main takeaway is mostly what you need to do in your home is good cleaning as demonstrated with soap and water.
Thank you. That was a great summary, and hopefully that clarifies questions. as a indoor quality specialist myself, one of the questions that piqued my interest, several people asked about ozone. They've heard that ozone can be used to kill bacteria, and since that's what we're trying to do, there's several people that are interested in ozone, and I know different presenters made brief references to that, but could one of our panelists clarify ozone use?
This is Nancy again. I'm the one who brought it up. No, do not try to use ozone. It is very bad for respiratory health. It's bad for your electronics and your plastics, and there's no evidence that it's killing COVID-19. There's a lot of marketing and pushing of products that are completely unnecessary. Open your windows and flush your house out. Do not try to use ozone.
Thanks. I think that's a pretty clear answer. And if anybody needs more evidence, you can look on the EPA website and learn more about ozone and how it can affect your lungs, as well as was mentioned, all the materials in your home. And there's quite a bit of questions, I'd say a dozen or more, about the specifics of microfiber. So I'll kind of list a few of these, but all of these are related to microfiber. Some of the questions are related to the steps for cleaning, disinfecting, and that kind of thing. So if we could review those quickly. Some of the questions were like, how long should you use a microfiber cloth? One question was specifically in a clinical setting, how often would you change your microfiber cloths as you're cleaning? So I know we had a couple of panelists discuss microfiber, but if one of you could perhaps try to clarify that a little bit for people.
So this is Denise. I'll mention a little bit about microfibers. Microfibers, the benefit of the microfibers is their technology, their weave. Instead of being a bigger strand, it is very small. So to be classified as a microfiber, it is 1/6 the size of a human hair. I've seen them all the way up to 1/200th the size of a human hair. What that does is gives you a lot more surface tension, which means you can get into space and get into the crevices and break it away from the surfaces better with the microfiber technology than with like a cotton towel. The microfiber will bring the germs and the dirt into the fabric, into the microfiber, where like a cotton towel will be pushing it. So it's really a nice upgrade in your cleaning ability to leave things residue free, plus being able to dislodge them from their surfaces. With microfibers, you do always want to make sure you are not using dryer sheets and fabric softeners, because they will make a coating on the outside of them and make them less active. Also, bleaches aren't usually recommended because it will break down the fiber. It is recommended that you use a microfiber that is fairly new. You don't want something that's super old, because you want these at a very high level and a higher quality for a couple reasons. We don't want them to break loose and get into our water systems, but we also want to make sure we're using a dense, high quality microfiber. The care of them is soap and water, washing them with your normal laundry. You just want to make sure no dryer sheets and fabric softeners. A great technology added to, and then I'll let some of the other panelists talk more about microfibers.
This is Nancy. I don't really have anything to add to that. I know there is concern with washing it and the microfibers going down the drain into the environment. That is a concern, but at this point, we're hoping the technology will move to better filtration on our washing machines, because we do not have a good substitute for microfiber cloths. They really are superior. I tell people at my trainings, soap and water and microfiber cloth, and you're going to remove 99.9% of your germs, which is an unregulated claim, but so are the claims on a lot of your products if you're buying something that's not EPA registered. So, you know, the idea is soap and water and cleaning. I tell people I don't use disinfectants in my house. I clean with soap and water. I remove things. The disinfectants are for killing what you leave on the surface, so it depends on the environment and how well you're cleaning.
Thank you. I appreciate you identifying the value of microfiber. I was involved in a research project with University of Tulsa a couple of years ago, and they'll be publishing soon about effectiveness of using microfiber in homes and schools. So I look forward to providing more information on that. I think there's someone else that was going to add.
I wanted to mention a little bit about when I did the demonstration. If you could, I would use microfibers in all three stages of that, the washing stage, the rinsing stage, and the drying stage. You're going to get maximum benefit of those microfibers. They are incredible. But if you only have one microfiber, it's fine to add it into one of those steps. And then at the end of the using the microfibers, go ahead and wash it with soap and then rinse it out really well and hang it up before you use it again. So thanks.
Thanks for that. And one of the features of microfiber, if you've been out purchasing them, is you can get them in lots of different colors. That way you can track how you're using them and not mix them up. I think one thing that we haven't mentioned, though, is how often switch towels, like say in a clinical setting, if you're doing the spot cleaning, disinfecting that has been advised, how often would you switch out your microfiber cloth?
If you're working in more of a clinical setting or a veterinary clinic, you're going to want to change them out. I've seen in different studies, like between each room, you're going to want to clean the microfibers out. Within a home, it's not that big of a deal. You may have different colored microfibers, like you just mentioned, for like a bathroom versus kitchen. But in a clinical setting, you are using specially color coordinated, and then you are changing them out much more frequently than you would in a home setting. I hope that kind of answered that.
Yeah, I think so. We have a couple of our friends from Alaska that are asking specific questions that are unique to Alaska, but I know it's also a problem in here in northern Arizona, where we have homes without running water. So would anyone like to speak to how a home without running water would apply all the things that we've been talking about?
I was actually thinking about this prior to this thing. So my suggestion would possibly to get like hand wipes, like baby wipes that are unscented, safe for baby cleaning, and then maybe a microfiber to go with you. I guess you're still using a tiny bit of water. It would be way less water, but you'd be washing your hands with the baby wipes and then rinsing and drying with the microfiber. I'm not sure beyond the hand sanitizers if that's effective, but that was the suggestion I came up with.
And Mansell, Abby Nelson's on the call from ANTHC. I can take a second and try to unmute her, as I know that they work on guidance with that. Abby, if you can hear me.
Actually, she's the one that asked the question.
Oh, well, there you go. Hi, Abby.
But she may have been asking it for us to talk about it. If she's available, she might also have some additional guidance. So while you unmute her, I would ask another question from our Alaska folks, and that is addressing the use of HEPA filters in our indoor air. Is there a role for COVID using HEPA filters, or should we stick to ventilation? Any suggestions in that area?
This is Nancy. There's still research going on in that issue. If you're running a HEPA air cleaner, it is probably going to collect COVID-19, but nobody's particularly recommending air cleaners for that purpose, but that could change. I don't know if the person from CDC knows if anybody's looking at that. I know my colleagues in indoor air quality around the country are looking at these issues. So if you're already using one because of particulates in the air, it's probably going to collect your viruses. Just remember that they will take a while to die. So if you're changing your filter, if you haven't let it sit for a day or two, you could get a snoot full of virus. If you're not careful, wear some protection. I have seen information on that, but again, the more fresh air you can bring in, the better.
Thank you, and
Oh,
thanks for the
I should
plug on
say,
ventilation.
whether it's collecting enough virus to make a difference is in debate and discussion right now.
And Abby, I believe I still have you unmuted if you wanted to weigh in on either of those two questions.
Hi, can everybody hear me?
Can hear you
We
great.
can hear you, Abby.
Yes.
Great. I could address this, but Brian Barabay from our Department of Community Environment and Health at Alaska Native Tribal Health Consortium is on the line, and he helped produce some guidance. So I'd like to invite him to talk on this subject. Gillian, could you?
I am. I'm going down to the B's. Take me a while here.
Barabay, B.
Yep.
Yep.
Just looking for him. You should have named yourself AAA, Brian. There we go. Okay, Brian, you're good. You're on the air. So you're unmuted on our end, but we can't hear you yet. It looks like you are not, not attentive. Sorry.
Apparently that's not going to work, but we do have several people do green cleaning, and they asked about some of the classic green cleaners that get used, like baking soda and vinegar. Would any of our panelists like to address using those for cleaners?
I'll touch that one. So this is Denise. So baking soda is really great for breaking surface tension if you want something that's a little bit of abrasive. And vinegar is an acid, so it's a good rinsing agent. As far as what we're doing for this specific thing and in cleaning in general, there's not much of a better cleaner than just using the basic like dishwashing liquid or hand soap, because we want that soap. We want the bubbles. We want it to break things loose. We want those degreasers to deactivate or to break down that virus. So soap and water is still our very best one. The most important thing with soap and water is the rinsing and the drying. So sometimes keeping it really, really simple is our best plan.
This is Nancy. I agree. Vinegar is not considered a really effective disinfectant. We really want to focus on the soap and water. If you use vinegar, for other purposes, that's great, or for window washing, but you can't rely on it as a disinfectant for this virus.
Gillian, thank you very much. And Gillian, did you have any other questions, or do you want me to keep going with a couple?
Go ahead and keep going. For those who are being patient and listening, I think we'll probably take about 3 more questions and then start to wrap up. But any questions we don't cover today, we will record from the webinar and address those in our follow-up to you. So Mansell, if you want to, and I just mentioned to Abby and Brian are still unmuted. So if it works for them to loop back in at some point to answer the Alaska specific questions, we're ready to take those from them. But why don't you go ahead, Mansell? Thank you.
So we have our Alaska folks.
We're trying to reach them. Yeah. So until then, I was just going to say, go ahead and go to general questions. Yeah.
Several people are enamored and ask questions about essential oils and the use of essential oils. And some of them feel like essential oils can enhance the, I guess, disinfecting of the air. So any of our panelists want to address that?
This is Nancy, and Eileen might want to say something too. No, they will not enhance the disinfecting in the air. They may smell good to some people. To other people, depending on the essential oil, they can cause headaches, migraines, sensitization, and asthma attacks. So you have to be very careful with them. But no, they're not going to disinfect the air.
Did you want to add anything to that, Eileen? I don't know if Eileen is even still on. We brought her in on speakerphone. All right, well, there was also a category of questions with devices. So devices like UV lamps, several questions about using steamers. Do any of our panelists have any advice on UV lamps or steamers as devices for combating COVID contamination?
This is
So,
Nancy.
oops, sorry, Nancy, one moment. Go ahead and answer. I'm going to get Eileen back on the line too, because she does a lot of work with the steamers. So go ahead,
Steamers,
Nancy,
yeah.
and then I'll put her on the line.
Steam cleaning is probably pretty effective, and as Gillian said, Eileen has been doing more work in that area. Obviously, hot water is a really good way to clean if you're careful with it. I do not recommend UV lights at all in the general environment. Leave that to the hospitals who know how to use it. It's extremely hazardous, extremely dangerous, and you would need high intensity to have any efficacy. So I would not recommend UV light.
Okay, and I believe I'm unmuted. I'm going to put Eileen on. Eileen, if you didn't hear, the question is about the use of steamers as a method of cleaning and disinfection.
Right, thank you. And yes, they can be, there are a couple of, actually they use vapor, which is beyond steam, and they are EPA certified to kill and to disinfect. There's a company north of here in Everett that sells them. You can find them across the country. They are quite expensive, but they are registered to disinfect using tap water, which is really quite amazing. They do take some time to get used to. It is quite a sort of I actually have one type of unit. They're bulky, but they do a beautiful job of actually removing, like what Denise was talking about, is removing things from the surface. They break up that tension. They work beautifully for that. So yes, they can work if they're used correctly once again. Thank you.
Can I pop in on this as far as the steam cleaners are using vapor technology? There's a lot of products that you can get from different stores that people are using in their homes for steam cleaning. That's not exactly the same as like a vapor technology where you're using the vapors. The steam cleaners, a lot of times we're not holding them at a high enough temperature or holding it on a surface long enough to actually do what you would be doing with vapor technology. So steam cleaners, a lot of times they're not as effective. They are really good for residue-free removal. But as far as banking on that as a disinfectant, I would say you'd want to make sure you have training on that. And also to be aware on, you don't want to put that hot steam on like hardwood floors or heat sensitive or moisture sensitive surfaces, because it might damage it.
Yeah, I agree. And if you think about the areas you really want the high touch surfaces, steam is not going to be effective on all of them. I like to believe someday we'll have a way to steam clean public bathrooms completely, but you have to remove the organic matter and the dirt and the gunk. You can't just steam it. You have to have a removal system too, and it has to be safe. So there's a difference between commercial and home use of these products.
Gillian, you said 2 more questions, and I think I have some good candidates here. My in-laws are Navajos, and I know that they've been out collecting sage to burn in their homes because they're concerned about the COVID. So the question that's been asked by a couple of folks are things like sage, sweetgrass, etc. Would those and burning those in the homes? Does anybody have any thoughts about those practices, which are frequently done in traditional communities?
This is Nancy. Again, it's not going to disinfect the home. I don't know about the oils that it'll put into the air and how those may affect people, but it's not going to disinfect the home. There may be other reasons. Again, you'd want a lot of ventilation.
Celeste,
Yeah,
did
and
you
this
think?
is,
Yeah, go ahead.
yeah, I was going to say that. I actually think that I would recommend it, because I know that the reason that people are doing it is for their own well-being and health. And I think those spiritual and mental health reasons are just as important. So yes, like Nancy said, it's not going to disinfect your home, but I think we should continue to encourage it.
And then the last question I have, and a reminder to everyone who's still with us, we still have over 700 participants. Probably the most frequently asked question is getting access to the information, the recording, the websites, etc. So do you want to answer that question, Gillian? Then I'll have a final question about cleaning air.
Yes. So this recorded webinar, there will be a link in, so GoToWebinar sends you a thank you for participating email. We also have the ability to attach documents to that or to include a link. So because the bandwidth, there'll be videos, resources, handouts, you will likely see a link. We'll make it very, very clear that will say, click here to access slides, videos, presentations, and resources. I wish I could tell you right now what that's going to look like, but I think in the next couple hours, we're going to be working that out. I may have mentioned we had 2,200 organizations and individuals nationwide register. So we're working quickly later today to get it out to those additional folks. I also think that at least for my organization, Mansell, Andy, we will probably have hyperlinks on our website. And I suspect I have somebody working right now on my website to hyperlink. Let's see if it's there yet. It does not look like it's there yet, but it will be here on our, they'll be uploading it within the next couple of hours. So yes, thank you again for Mansell responding to the questions. You're clearly experienced with facilitating, so I appreciate that. And why don't you go ahead and wrap us up for today?
Well, thank you, Gillian. You did a great job bringing together lots of great people to talk about this topic. And there is an individual that mentioned that smudging is not good for those with respiratory problems. And since he mentioned it, I will say personally, I cannot tolerate smudging at all. I agree that it's important culturally, and that those who practice that, I wouldn't discourage it, except to keep in mind that there may be individuals that won't be able to handle the smudging. So the last question that we're going to wrap up with today is, we know that the virus is transmitted through the air. So, and we've really talked about a lot of different things related to that. But the question is, what's the best way to clean your air? Any of the panelists want to respond to that?
This is Nancy. Open your windows and flush your house out. Really, that is the best way. I hadn't heard the term smudging before, but it does make me realize that some of the new research coming out shows that in areas with a lot of air pollution, that does do lung damage and seems to make people more susceptible. So the cleaner we keep our air, the better we all will be.
I thank you for that very direct answer, because that's exactly what I would have answered as well. Lots of good ventilation is one of the keys. And in fact, Nancy and I are already talking about perhaps the follow-on webinar to talk more about ventilation. So we'll get the word out about that if you have interest in that additional topic. So with that, I'd like to thank everyone for joining us. It's been a long webinar, but there's been a lot of information shared. We will get out that email that Gillian talked about with links. We'll also have a link for feedback. One of the things we're looking for feedback on is how else can we help you with information and education. Both Gillian and I are interested in helping folks. As of course, all of our panelists here today have interest as well. So in our feedback, if you could let us know if there's additional topics that could help you, please let us know, and we'll be working on that. So thank you very much. And Gillian, I'll let you have the last word because you're our primary host here.
Enjoy some fresh air today for those of you who can get out and stay sequestered at least 6 to 12 feet away. And thank you again for participating. Thanks to the panelists, and please keep us on your radar, because again, once this is over, we hope you now know, we didn't want to scare the crap out of you, but we do hope you know that there are hazards that have always been there, and now we've been able to point the arrow towards them, point the compass towards them a little bit. So thank you again. Enjoy a little bit of time outdoors, hopefully everyone, and take care. And with that, we'll stop the broadcast.